Hello and welcome again. Today we will see about introduction to anatomy. We will see the definition of anatomy, the scope, terminology, body organization and medical imaging. Why study anatomy? Because it is foundation of all medical and health sciences. It helps us understand body structure and structure function relationships. Essential for diagnosis, surgery, imaging, research and education. The clinical relevance of anatomy. Anatomical knowledge guides physical examination and surgery. It supports interpretation of imaging, X-ray, CT scan, and MRI. It helps localize pathology and plan treatment. Definition and scope of anatomy. Anatomy is the study of structure and the relationships among body parts. Its branches are gross, microscopic, developmental, comparative, and clinical. Links structured function for medical application. Branches of anatomy. Gross anatomy. Macroscopic structures. Microscopic anatomy. Tissues and cells. Embryology. Development before birth. Surface anatomy. Landmarks for clinical use. Radiological anatomy. Imaging applications. Anatomical position. Standard reference for anatomical description. Body upright facing forward, arms at sides, palms forward. Used globally to avoid confusion. Directional terms. Superior, inferior, anterior, ventral, posterior, dorsal, medial, lateral, proximal, distal, superficial, deep, ipsilateral, contralateral. Levels of structural organization. Chemical, cellular, tissue, organ, organ system, vein, organism. Example: atoms, molecules, cells, tissues, organs, systems, human body. Anatomical planes. Sagittal, left or right, coronal or frontal, front or back. Transverse, upper and lower. Used in imaging and surgical planning. Planes in imaging. CT and MRI scans often taken in standard planes. Sagittal MRI. Brain midline structures. Axial CT. Brain bleeds or tumors. Coronal scans. Sinuses, spine and more. Body cavities. Dorsal cavity, cranial, vertebral, ventral cavity, thoracic, abdominopelvic. Cavities contain organs and provide protection. Abdominal regions. 4 quadrants. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. 9 regions. Right, left, hypochondriac, epigastric, right and left lumbar, umbilical, right and left iliac, and hypogastric. Used for clinical localization. Example: appendicitis. Medical imaging techniques. Part 1. X-ray. Its main use is for bone and chest imaging. Ultrasound. Pregnancy, abdominal organs. CT scan. Detailed cross-sections for trauma and tumors. Medical imaging techniques. Part 2. MRI. For soft tissues, brain and joints. PET. Metabolic activity and cancer. Hybrid imaging PET CT. Anatomical plus functional data. Clinical correction. Example 1. Right lower quadrant pain. Appendicitis suspension. Imaging confirms diagnosis. Anatomy knowledge guides safe surgical incision. Clinical correction. Example 2. Stroke imaging uses standard planes. Identifying arterial territories requires brain anatomy. Guides treatment decisions. Summary. Anatomy is essential for understanding the body and disease. Standard terminology ensures clear communication. Imaging and clinical corrections make anatomy practical. Here are the references and thank you for watching. See you next time.